Hi everyone, I want to start with something personal today. When I had my first baby, I experienced postpartum blues. It wasn't because I wasn't happy, it was because there were lots of stress, exhaustion, and lack of sleep. What truly helped me was the strong support of my husband and my family. Without that support, I honestly believe it could have become postpartum depression. So during my master's research, I also learned how much postpartum depression was, common. So I found that about 13% of mothers had postpartum depression in one city, and this was done only in two hospitals. So many new mothers feel, overwhelmed after childbirth. But when does normal mood change become, a serious emotional condition? So let's explore that. So when we see postpartum blues, it's often called baby blues. It's common transient emotional reaction after childbirth. Most mothers experience mood swings, tearfulness, anxiety, irritability that usually peaks around day 5, but it improves by 2 weeks. And the baby blues are believed to result from sudden hormonal change, disrupted sleep, physical exhaustion, and psychological adjustment, to motherhood, which is very new. And these are all common and usually temporary. So when we come to postpartum depression, it's a more serious, persistent mood disorder, and it begins within the first months after childbirth, and it lasts more than 2 weeks, and it significantly affects how a mother functions. It affects the daily activity of the mother and within the bonding of the mother and the baby. So, unlike the self limiting baby blues, postpartum depression involves persistent sadness, loss of pleasure, fatigue, disturbed sleep or appetite, and feeling of guilt or worthlessness. It may even include thoughts of self harm or even harming of the baby, which requires immediate help. So here's a simple comparison. Blues begin early, they're short lived, and don't majorly impair function. The postpartum depression is longer, deeper, and it interferes with daily activity and life and caregiving of the baby. So, let's see the factors that increase the risk of postpartum depression. So, it includes prior depression or anxiety, stressful circumstances, lack of social support, as I have explained earlier, which is such a crucial component, and complications during pregnancy or even delivery. So clinicians use screening tools like Edinburgh Postnatal Depression Scale and structured interviews to diagnose postpartum depression based on established criteria. So what we should know here is that postpartum depression is treatable. So psychotherapy, especially cognitive behavioral therapy, can be effective, and sometimes medication is also recommended as necessary. So support from parents, family, and community is very essential. So when you next time when you think of checking on a new mom, just be supportive. Show a happy face. Don't add up on her already existing stress. So, when to seek professional help? Well, you have to do that if symptoms are severe, if there are thoughts of harm or harm to yourself or even to the baby, and if you can't function daily, the simple tasks that you're supposed to do. And early support saves life, trust me. So, if you and or someone you care about is struggling after childbirth, know this that you're not alone. Awareness, early detection, and compassionate care makes all the difference. And this is the most important info that I want to swing by you today. So thank you very much. Comment if you had any of experience, you can help others, and let me know if you like this video. Thank you very much. Bye.